Project Choice was developed and designed in City Hospital Sunderland in 2005. It was unique, innovative and brave. The programme was supported by the Trust Board and the Chief Exec and enabled young people with learning difficulties, disabilities or autism to access all aspects of city hospitals and gain the work skills they needed to develop their confidence, their abilities and their skill sets. Project Choice enables the NHS to look at the whole of the workforce, to look at the skill sets it needs for the future and to develop young people into those roles. Project Choice enables young people to gain multiple different experiences across the whole of the NHS in all departments, wards and areas and decide what is right for them. Beginning in city hospitals, Project Choice was shown to be an excellent model of developing a true workforce. The programme was talked about by staff, shared with staff and then engaged with other staff and other trust boards and chief executives across the North East and North Yorkshire so that all of the NHS could become part of the programme.
I've nominated Lucy Gash, who's a chemotherapy nurse specialist at City Hospital Sunderland, for her work on the Macmillan Chemotherapy Prison Project. Lucy has great leadership skills. She's very approachable, she's great at project management, she's well focused and really good at keeping to her timelines and the steps that she wants to achieve. She has a skill of knowing what's needing doing almost before anybody else realises that it needs doing, and she just keeps the whole project running very well. Specific reason that I've nominated Lucy for this award is for her work with the Macmillan Chemotherapy in Reach service, taking chemotherapy and supportive treatments into prisons in the region. Lucy has done so in a great way. She's gone into prisons, which is a completely different environment for her, and she's adapted our approach to get people on board to make a really significant change in practice, which it would be fair to say some people were a little nervous about and reluctant towards doing. The project has offered a great improvement to the prisoners' experience of the quality of care received when they have chemotherapy. It's reduced the anxiety for other patients needing chemotherapy in the hospital setting, and the reduced security risk of prisoners not having to leave prison quite so much is another advantage of the project. And Lucy's managed to do all of this whilst keeping the project on board and managing to make cost savings in doing so.